I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I am Mike Bonds.
Jeff Doherty, Diana Klein.
Joe Latondre is not present, obviously, and Frank Simpson is not present also. Okay, the first call of order will be public comment coming through here. We do have a message on the best project. We'll let that a little later. The lead.
Oh, the letter.
Yeah, so if you have any comments on the best project on the battery plant, hold off into public comment number 2. Your answers, your questions might be answered when we do the letter here, more or less. Okay, so you have your list?
Can we make a motion?
Oh, I'm sorry. I make a motion to open public comment number 1.
Second.
All in favor?
Aye.
Okay.
So, yeah, lift in the back. Folks, just notice that I've pulled this camera out a little farther than usual from the wall, so just be extra careful about the wires, please.
Steve Bauer.
I'll wait.
Wait, is it comment? Okay. Anybody else wish to speak on the first comment period? No one wishes to
Okay.
address the board at the moment, Mike?
I make a motion to close public comment number 1. Do I have a second?
Second.
All in favor?
Aye.
Okay, report supervisor. Board members, you have your financials here. All right. We're not gonna pass the financials until next board meeting, so this way you guys can review it, go through it more or less. Any questions you have, you can address it to myself, or Wendy, or. Okay, so, all right, town clerk report. Oh, I do have one other thing. For those of you living on the Four Corners by Hurley Avenue and Main Street, we started doing the crosswalks. You know, the big holes in the ground. That's gonna be for the crosswalk come through, and so that should be done soon. Now comes the hard part, getting the county to come in to paint the lines. So, we were hoping to be done before school starts. We weren't sure which year. All right, so, they had promised us that they would do it once the sidewalk is in place. Okay. Anybody in the board wishes to say something about anything here? I have another thing too. We're gonna make we have moved Diana Klein to be the liaison to the housing committee. All right, she's gonna be in touch with Ty Lord Farmer from Ulster County Planning Board. We have a meeting here. Once we join, once we have the housing committee, more or less, we can apply for a housing smart grants with this thing that help from the affordable houses coming through. Okay. All right, we got a whole bunch now. I gave you a whole bunch.
Lynn, yours is up on the screen.
Okay, because mine is not in my packet.
It's in, put it in the back of my package.
Okay. So during the month of July, town clerk's office collected $46,870 and another $28, which goes to the state of New York for the spay neuter program. And as you will hear from the transfer station's contribution was $26,000 last month, change, and the building department was just over $19,000.
Okay,
Yes.
I make a motion to accept the clerk's report. Do I have a second?
Second.
All right, all in favor?
Aye.
Aye. Okay, John?
Well, since our last meeting, we have solidified the food trucks for the Hurley Day, which is going to be September 13th from 10 to 2. All are welcome. There is no fee. There was a little discrepancy last year. So we're planning on providing entertainment, food. We'll have flag football be going on up there, which is also going to be potentially entertaining. But it's amazing to see over 200-300 kids playing on these fields and really trying to provide something that hasn't really been happening in the town of Hurley, Pawtucket for a long time is actually utilizing our fields. So they're starting to really pick up some momentum, as well as we now have other entities that are looking to utilize the field. And I think as we start repairing and rebuilding, I think we can get a lot more. Moving on to that part, as far as the field updates, we do have, the town is still trenching for our water and electric. We have solidified the electrician and plumber in the next couple of weeks to finish that project. So we should have the electric ran out to and water out to the outfield, so we can, one, have electric for the scoreboards and timekeepers for the flag football and anything else going on, as well as when we go to do the outfield, and we'll have the water for seeding and such in the fall. So that's about it.
Right, there's two things I want to bring in. First of all, I want to thank Matt Connors for maintaining the fields.
Okay.
He does a nice job maintaining the field. Second of all, I want to thank Mike Schultz and the highway department for their input in all this. This is all part of a $160,000 grant. $80,000 provided by the county, $80,000 provided by us. Our $80,000 can be work in kind. So in other words, whatever work Mike Schultz and the highway department does, it adds on to our $80,000 going through it. And we started getting reimbursements from the county. We got the first reimbursement back, the first thing. And so things are working out very nicely and so forth.
We'll have a little over $60,000 project in the fields. Our fencing and everything is completed at this point. But moving forward, it's probably we're going to use every penny of that to get this field where we want it to be for.
And I spoke to Jeff Flat Plumbing. Jim Boyle, who's our main person there, he's on vacation right now.
Yep.
He'll be back next week, and I have a call with him, and he'll get the filtration system going.
Yep.
And I also spoke about we did a water testing on it, and the water's safe. As long as you don't take a shower there. It's hard water. And I want to thank John Perry, obviously, because
Thank you.
Yeah.
yeah.
Taking a look at it. And you said the scoreboard will be up this year.
No, there's flag football has their own time clocks and scoreboards. So with the electric being out there, they don't have to run 300-foot cords to the pavilion.
Okay, highway report, Mike Schultz is not here, so we'll forego that. Building department, you want to talk with the Paul?
No, thank you.
That's the first time I heard you say no.
His report is on the screen.
By the way, I just wanted to introduce, I don't know if you know, sitting next to Paul is Martina. Martina Jarvis, she's our building inspector also. She came on the job on May 1st and doing a nice job so far. Thank you so much. Okay, assessors report. I gotta say something about this report and so forth, which is really disturbing. In 2024, we did 100% equalization. In other words, our assessed values is the fair market share. We just found out right now, our equalization rate now is 92%, which means in about 8 months, the prices of housing in Hurley increased by 8%. Which is like,
Well, that's what happens, yeah.
yeah.
So I'll be working with Brittany because we will be formatting some sort of budget so that we can do that equalization rate at least every 10 years.
Well, we told you every 10 years.
So, but I know she's going to be looking at trends and she's potentially going to be, trying to get that back into the 95, 98 realm so we can.
I want you to be aware of something. In most cases, when we do the equalization rate, the taxes may seem like they're going up, but they don't go up because what we do is we lower the tax rate. So in other words, your taxes are then equalized.
Right, not the school.
Not the school.
Not the school, it's only the town
It's just your general highway.
Okay. All right, how, are you busy, Laura? Can you wait a few minutes more, John?
I'm good.
Okay, Dr. Walters is here from the Board of Health.
Up there?
Yeah, the mic is on, just bend it if you need, I'll get your report up.
Can you hear me? Is this good?
Yeah, just come in close, you're fine.
All right, how about that? It's on?
You're fine.
Well, I'll take this moment while he's loading it up to actually politely correct you. So it's the Department of Health. And a lot of people mix that Department of Health and Board of Health. So I'll just say quickly, the Board of Health is actually kind of our governing board. So every Department of Health has to have a Board of Health. So that's members of the communities, the hospitals, health centers, who actually meet every month. And they're the ones who set our policies, our fees, and everything like that. So we do have a Board of Health, but this is about the Department of Health. There.
You're good to go.
Okay, so as you can see, we have been here in Ulster County since the mid-1940s. So we've been here for a long time. And our mission is to protect, promote, and improve the health and well-being of all residents in Ulster County to achieve their best quality of life in all stages of life. So local departments of health are arms of state departments of health, meaning they set these laws of what should be happening in the local levels, and then we are required to implement those laws. So the Department of Health is guided by Public Health Law 602 to do certain activities that we are mandated to do. This is good in that they give us money to do it. We're one of the few departments in the county that is almost fully funded by the state. They call it grant funded, but it's not competitive or anything. So we get what's called Article 6 funding, and most of our programs are funded by the state. The bad news is that then they set the rules of how we respond to things. And so even if we felt we wanted to, even if we felt like we wanted to do something if a PFAS level was above this level, but the state says, no, it has to be above this level, we're not allowed to do anything. We can only abide by the state regulations. And so it has its good and its bad, but under this state law, all local health departments in New York State have to cover communicable disease control, chronic disease prevention, environmental health, family health, public health emergency, education on health issues, and development of health policy. So I'm going to talk about our department and how we address each of these issues in general. And then I'm also going to talk a little bit about what we're doing here in the town of Hurley. So, the colors. So what's in orange are the divisions in the Department of Health that are specifically designed around that law that you saw on the other page. So family health division, community health, public health preparedness, and environmental health. In addition, we have two other divisions. So WIC, Women, Infant, and Children, is a separate state grant that the Department of Health holds. Different people have it, different agencies have it in different counties and in different states. It happens in Ulster County that it's in the Department of Health, but it's its own entity, even though it's under me in my department. And then the medical examiner's office, which every county is required to have either a coroner or a medical examiner, depending on its size. We're required to have a medical examiner. This is the only program I have that is county funded, county taxpayers funding only. There is no state money for it, even though it's mandated. So that's the only program. All the other ones are being paid for by state dollars. Okay. So our Division of Family Health, we offer free immunizations to adults and children. It is restricted to people who either have no insurance or are underinsured, meaning you may have insurance, but if your insurance won't cover the cost of that immunization, we can provide it to you for free. We also are starting a program to do home visits for high-risk births. So a mom who might have had gestational hypertension or gestational diabetes, preeclampsia, the child was premature, our nurses will reach out and ask if they can come to the house, and they'll come to the person's home, check on mom, check on the babies, and with a real goal of encouraging the mom to get herself back into primary care, because if she had a high-risk pregnancy, it's really important. It's easy nothing's easy when you have a baby, but it's very common for a new mom to focus on the health of their babies and forget about themselves. So a lot of this motivation is also to encourage these moms to make sure they're taking care of themselves. We have sexually transmitted infection clinic. I'll say the immunization clinics are every week. Our STI clinics are twice a month. So someone can come and if they want to be tested for an STI, we also provide treatment. We will also be informed as your county health department if someone has select sexually transmitted infections, and we'll reach out to that person, identify if there's other people who maybe should be tested, and take care of that. With tuberculosis, same idea. We have a clinic once a month, but if anyone has tuberculosis in the county, and it is going up across the whole country, we are informed and our nurses will reach out and provide treatment. For tuberculosis, you have to be isolated from everyone and on medication every single day for the course. I think it's like 5 to 8 days. I always forget. Our nurse will go to the person's house or wherever they're isolated every single day, provide them the medication until they're out of isolation.
Good.
Our WIC, Women, Infant, and Children program provides nutritional supports for mothers and parents and children up to the age of 5. So we have the SNAP enrollment, we have 2 peer breastfeeding educators, and we do nutritional education. While SNAP can be achieved in other places, people get SNAP through DSS or other services. What's nice about the WIC app is when people are enrolled, they get something that they can scan QR codes in supermarkets, and it will tell them whether the object they want to buy is covered by SNAP, so they don't have to go through the embarrassment of going to a cashier and them telling them that it's not covered. And this is these are all nutritionists. Go ahead. So our environmental health program is our biggest program. Out of our approximately 80 people in the Department of Health, I would say about 25 of them are in environmental health. So they're focused on protecting public water sources, approving water and septic plans for any new development, ensure safe food preparation, so for your restaurants and vendors, food carts, ensuring safe children camps, public pools and beaches, safe migrant farm worker housing, mobile home parks, and temporary residence, which is the other word for hotels and motels. We also respond to lead poisoning. There's several different ways that people come to our attention. The first is purely voluntary. Apparently, I was at a meeting the other day. Actually, no, it was today. New York State has the highest number of homes that were built before 1980, I guess, in the whole country. And so, yeah, I didn't know that. I didn't fact check her though, so don't fact check me. But so one thing we have is if you live in a home that's built before 1980, you're concerned about lead exposure, you can contact the Department of Health and we'll send our technicians and their very fancy machines to check whether there's lead in your home. That is 100% voluntary. However, if we find lead in your home, it stops being voluntary. Now we are mandated by state law to stick with you until you remediate the problem or we actually have to fine you. So if we know there's lead, we can't do nothing. The second way that we find out that there's an issue is if any child has an elevated blood level in the county, and doctors are required to do these blood tests, we are informed, and then we have a kind of divided process. So our nurses will work with the parents and the children until the child's lead level is at the level it needs to be, while our technicians or sanitarians will go to the home, test, figure out where the lead is, and work with the owner on remediating the problem.
Sorry about that.
We respond to rabies. So if a person feels like they've been exposed to a rabid animal, we test the heads. So if you are, I don't know if anyone's here is law enforcement, but if you're calling your law enforcement to shoot an animal that you think is rabid, for our sake, tell them not to aim for the head. Go for the body because we need the head. Also, if you feel that you have been interacted with an animal that was rabid, then you can go to Health Alliance Hospital. One of our experts will talk with you and the doctor just to determine whether you need the prophylactic medication. It's not fun to take, so we want to make sure you definitely do. If it turns out that it is, we pay for it at the Department of Health, which it's a significant cost, so it's great. So nope, don't be all finger twitchy yet. Ticks. So we will test ticks. More importantly, if you have a tick on you and you're worried, you can always call someone at Department of Health. They'll talk with you on what it looks like, how long it's been, give you suggestions of what to look for in signs and symptoms. We do test them, but we want to be clear that this is not diagnostic for a person, because a tick may carry a virus. It doesn't mean the person carries it. A tick may not carry the virus. It doesn't mean the person doesn't have it. So we do test them, but we do it more for our own surveillance to know what's going on. But we will help you to know when's the right time for you to go to the doctor. Lastly, we regulate illegal tobacco sales and illegal vape sales. So illegal tobacco sales are sales of tobacco to minors. So every summer, we have a young person who is 18 who will go to these different places across the county, try to buy cigarettes. If they sell cigarettes, we will immediately issue them a violation. The vapes are people go out to the different places on a regular basis, and there are some flavored vapes that are illegal, not all of them, and the FDA keeps complicating this for us by approving something and then we have to allow it. And there's also a surge of vapes that come from China that don't even come through our Department of Taxation, like they're just, so we look for those and find them if we're finding those. Now you can go. Okay, we have a division of community health. This is where we make most of our connections with coalitions, other agencies out in the community. So we have the Healthy Ulster Council, which is made up of people from across the county and different agencies that relate to health. Then we do media education awareness, radio, TV, billboards to get the message out, but we also do events and fairs. So did anyone go to the Ulster County Fair?
Raise your hand, Bill.
There were so many people there, and I keep going to these town hall meetings and nobody, I went every day, but it's fun. And if you haven't gone to your Ulster County Fair, I encourage you, if nothing else, to go pet the little goats because they're adorable. But anyway, we're at the Ulster County Fair. Don't quote me on that. No, you can quote me on that one. So at the Ulster County Fair, we did a couple of things. So one is we were talking about environmental risk. So we had cooling towels and we had a nice bucket with water and ice and got them nice and wet for people. And it was really lovely because the first 2 days of the fair, it was about 100 degrees. And so at one point walking around the fair, every fourth person had like this bright orange Department of Health towel around their neck, but they were really, I would see people walking, but like, you need to come over here. They were just like dragging themselves. We also did blood pressure monitoring, and then anyone who seemed to be at risk, we would give them a home monitor for free to take home and have. We will go to any events we are asked to go, well, I can't say any event, but we are happy to go to other fairs and events. We try to do our best to get out around the county as much as possible. So yeah. Public health preparedness. So we work hand in hand with the county's emergency response. So that's another department, but we work very closely. The MRC, the Medical Reserve Corps, which is not just doctors, nurses, but also people who are interested in being on the reserve to be called if there is an emergency. So we have plenty of people who are in the medical profession on the MRC. So that is a combo DOH and emergency management group. So we do that together, but we also on a regular basis. So my emergency preparedness team is actually one person from emergency response and one of my communicable disease nurses. So they work together. We're trying to create a playbook right now on what to do before an event happens. So we are looking at what to do if it's an emerging disease that we never heard of, what to do if it's a disease that has a vaccine, what to do in these different environmental situations, flood, fire, smoke, and all those. So we're really working hard to try to be as prepared as possible. But what's nice is, what we found that the gap is emergency management. They have very strict playbooks. They're trained by the state. They're trained their whole life. well, their whole career on what to do in these emergencies. So when they have a flood or a blackout, they know they have to get people to safe grounds. They have to, those are their focus, and they do it in the immediate. But from a public health preparedness, we come from a different place. Like one of the things that we found was, even though this wasn't an environmental thing, but like during COVID, people who had chronic illnesses were going unmet because the attention was on COVID. So the same thing, you have a flood, you have a fire, the focus is people being safe, but what if somebody is on a medication that needs to be refrigerated? Then what do they do if there is no power? Does anyone have anyone in their life that uses a medication that needs to be refrigerated? Okay, got two.
Not in my life, in my person.
Okay, so this says medication don't leave behind. It's bright green on purpose. It has a little cooling pack, a place to keep the medication. And this way, because it says don't leave behind, you have a blackout, flood, you drop it, don't bring it, somebody's gonna pick it up and be like, I think you wanted this, so this is for you guys.
That's easy. Much appreciated.
All right, then you can go next. So our medical examiner's office, we have a forensic pathologist and three medicological investigators. One's about to be hired, I can count her. They investigate deaths that are either unexpected or unexplained, conduct autopsies, and try to understand what happened. Next. Okay, so Hurley, don't go ahead. Let me do my little spiel here.
Sure.
So this is now a focus on what we do specifically in your town. I like this section because every summer we hire 10 aides. We call them environmental health aides, but we do sometimes put them to work on other things. I tell you this because every year we hire 10 aides. They get 350 hours, they get paid a little over $18 an hour, and they get to try out, maybe they go with the foods and they investigate, they go to restaurant inspections, or they go to soil testing, or they go to camp or pool inspections, or they do other things. They get real hands-on experience. So we have college kids, we have non-college kids, we have teachers who are off in the summer. So when it comes around to next spring, you look in the Ulster County job posting, you'll look for the environmental health aides. Somebody or you yourself are interested, put in an application, tell them to, because I think it's a really rewarding experience. We are hiring 2 of our aides directly because they were great and we didn't want to see them go. The other reason why I point this out is because aides have downtime, and rather than them sit in a corner on their phone, I put them to the task of making the section of my presentation that's focused on each town or village. And so this has their own touch on it. It's nice for me to see how each aide kind of hits it in their own kind of way. And if there's a mistake, it's their fault and not mine. Okay, so Hurley. In Hurley, woo, they made your sharks nice and big. Children's camps, you have one children camp in Hurley that we inspect, which is Hurley Rec. For swimming pools and beaches, you have 4 swimming pools, one in Hotel Dillon, Hurley Rec, Hurley Ridge Condo, and Maverick Knolls. For temporary residents, migrant farms, and mobile homes, there are 2 temporary residents, 1 migrant farm, and 3 mobile home parks that we permit and inspect. And for water system, we have permitted 6 water systems and 14 septic systems in the past year here at Hurley. Food, there are 9 food services. You probably don't recognize them. 9 food service vendors in Hurley, 7 restaurants, and 2 mobile units. So this event that's coming up, those food trucks we permit them, we inspect them. If an event is multiple days, our inspectors are going every single day to make sure those food trucks are keeping safe. All right, so just to close it, the 4 areas that are my priority right now for the Department of Health. One is to improve trust in public health. Trust in public health health has deteriorated over the last several years for many good reasons. I think a lot of misinformation or mixed information, when you get things from so many places, it's hard to know what to believe. So for me, whether it's now or whether it's in some kind of crisis, I want the people in Ulster County to, if they're getting information from all over the place, I want them to say, you know what? What's Ulster County telling me? And so that you know we are here for you, and that if you're not sure how to discern what this information is, you can trust, we're hoping that you can trust us. Second is to improve awareness of our programs. Partly that's why I'm coming around. I'm going around to the towns and villages all over the county to talk about what we do. This helps improve trust. If you know, you see my face, you know what we do. But also because these programs were designed for you. Like, they're there to serve you. And so if you don't know what we have, then how are you going to take advantage of that? Wanting to identify and meet unmet needs. Part of that is right now, for the first time ever, we are doing, so every 3 to 5 years, we have to do an intensive community health assessment where we look at leading cause of death, leading cause of injury or morbidities, illness, risk factors, so that we can set an agenda for what the Department of Health will focus on for the next few years. Every other year, it was always Ulster County in general, and Ulster County suffers by the law of averages. On average, we're not bad. We're not too heavy, we're not too light, we're not too sick, we're not too risky, we're just on average fine. But we're not in pockets, right? Certain communities have certain risk factors higher than others, certain populations, certain people. And when we look on average, we don't know those stories. So we're getting this down to a zip code level. It's going to be on our website. It's due by December, and you'll be able to go and look at different chronic illnesses, different kinds of risk factors, and see how it's distributed by zip code across the county. It'll also help us to determine for our programming where we need to target certain types of programming. The other part is coming around to places like this. So there might be needs that you have in Hurley that we don't know about, and that we might need to figure out how to respond. So for example, I went to one town and they said, we have a lot of senior citizens, it would be really great if you could have nurses come to the homes and assess for fall risk. And I said, that's a brilliant idea. We don't do that. And I'll have to find how to do that. It's going to be an extra nurse's time. I'm going to have to find funding for that, but it's good to know, and I have something to work towards. So if you feel like there's an unmet need, you should always let me know, and we can figure out what to do. And then the last is being prepared to protect our county's health. So it's, we have a lot of real time, every single day in the Department of Health, there's some kind of fire to put out or some kind of thing happening. But it's really important that we don't just focus on everyday issues. We need to be prepared for the future. We need to know what kind of supplies we should stockpile, so if something goes wrong, we're not just scrambling to get it. We need to know what our staffing plan would be if there's something that happens. So we need to be prepared, and we're working really hard on getting ourselves and in turn you all prepared for whatever kind of emergency hits us next. That's it, except for if you have any questions.
I have a couple questions.
Okay.
You mentioned SNAP and the WIC programs. That's on a chopping block, isn't it?
So SNAP is on a chopping block, yes. From what I understand right now, WIC is secure. And I haven't been told yet that there will be any denial of services. New York was benefited by, and I'm sure other states, that the most funding streams for what we do, the money already came. And so the impact of anything chopped it's like subsequent years. So like if I come back here in a year, I might have a different story about where things are. Right now we're good. Right now we're stable, and they're telling me to enroll more people. So
My other question is on vape sales. The rules are changing.
in that,
I understand they lowered the age limit now. for
so
vape.
who can buy vapes in New York State?
I think it's federal. Lowered it.
From what to what,
Otherwise,
21 to
they
18?
put the restrictions on it, who can buy vapes and so forth among children, and the federal government did away with those regulations.
I'll have to check on that. I'm not aware of a recent change in age. So I mean, as far as I understand, I mean, I've not heard of a change in age, but that doesn't mean I might not. I mean, the federal government has made even more complicated for us is also knowing what vapes are allowed, because originally we were told all flavor vapes are not allowed, but then as soon as the FDA approves one, the state allows it. So yeah, I will say it's also what's challenging, to your point, which is something I'll be working on this year. For tobacco and vape sales, any nicotine sales, the way the law is written, a vendor only has to ask for ID if they believe the person is underage, which means that if they don't ask for, if they sell to a minor, they can go to court and just say, I believe the person was overage, that's why I didn't ask for ID. So we're trying to explore whether maybe in Ulster County we can create a law that says you are required to ask for ID, as opposed to allowing someone to only ask if they believe the person. But that's how the law is written, if you believe they're underage.
I just did a quick web search and it appears to still be 21 federally, but.
Okay, maybe they're discussing it, but it hasn't
Yeah, it
happened yet.
doesn't look like it's changed.
Yeah, I
We're
hadn't
talking
heard.
about the Z-Ray.
Okay.
Any other questions?
I have a, not a question, but a statement. I go to municipal board meetings 2 or 3 days a week for the past 30 years. And no one in your position has ever come to a municipal meeting and done what you've done. So bravo that you're doing that. I think that's.
Your slide presentation, you had 7 restaurants listed in Hurley. I have 3 active and 1 pending approval from your agency, a single room purveyor. I'm just curious where the.
The 7th one, and just keep in mind, that was when this was done, so maybe your permit requests didn't come in yet when they did this over the summer. I'm happy to get you the list of which 7 they are. Like I said, I did not spot check my aides. I know that their list is what's in our system at the time that they did it. But if you want, I will get you.
Paul, would it be something like a Stewart's where you can sit down and eat your hot dog?
Generally not, no.
Okay.
But I'll find out what those, just keep in mind,
I'll call Corey, it's not a big.
you can call Corey. Just, I want to also, it's important to recognize, some things are many things. Like a hotel might have a restaurant and a pool and, rooms. And so those are all counted separate, because when we go inspect a hotel or these large camps, many inspectors have to go, because one's looking at the food, one's looking at the housing, one's looking at the bathroom, one's looking at the pool. So I don't know if one of them is in one of the hotels, or, like they may not be standalone restaurants. They may be located within another kind of foods, some entity that provides food.
That'd be considered like a catering type of facility?
No, we don't do caterers. Well, we do, but it depends. I should say, it depends.
Certain people do it at their home.
Yeah, it depends on the nature of it, but I will happily get whatever the list of 7 restaurants were for you. Yeah.
In your tick testing, ticks, what are you finding this year?
We haven't gotten a lot this year. I can tell you, what did we, for New York State, so every week I'm in a communicable disease meeting with all the departments of health, the New York State Department of Health. I'm trying to think of what their biggest, the biggest news is that the longhorn ticks don't care for people. That's good news. They're increasing. We're getting way more longhorn ticks. The way they test is they do these like sweeps with these sticky stuff, and they grab as many they can. So we have an increase in New York State of longhorn ticks, but for some, and now I'd like to see the study where they figure out they don't like people. Like, do they stick their arm and the tick is running away or something like that?
Do they go after house pets or?
They'll do animals, but they, for some reason, are not a big fan of people. And then they also do similar mosquito screenings and tests. And so they have found mosquitoes with West Nile in our sister counties, not in Ulster yet, and hopefully not at all.
Is that stuff easy to find in your website?
That's New York State doing that, but so you could do New York State Department of Health mosquito, and I'm sure you'll get to it. Yeah.
Number 4 on your slide said be prepared for the future, and I hate to be the squeaky wheel, but how would that relate in the event that this lithium ion battery plant is approved? How are you prepared for any of the inherent risks associated with that?
Well, so part of our preparation, which, and it goes along with the kind of emerging diseases or illnesses that don't have a vaccine, can include any kind of toxic exposure, chemical exposure, if there was an anthrax. So, essentially, if a bunch of people are getting sick, we do have to respond and understand what's the cause of it. So I'm not saying whether it will or not in that situation, but if a series of people start getting ill for some reason, whether it's environmental, whether it's in a restaurant, whether it's wherever, then we get called to investigate. Our role will depend on the source, because if we don't permit it, if we don't regulate it, then there's not that much we can do. So a restaurant, easy. If it's a restaurant, we permit and regulate it, so it's absolutely our responsibility. Anything happens in a camp or pool, absolutely. When it gets to things that we don't, it changes on whether it's someone in New York State that's regulating, whether it's ag or EPA or whoever, all depending on who is the entity that is allowing this to happen. So we do have to stay in our lane. So it depends.
Thank you.
Yeah. All good? Well, thank you all for having me. And have a great day.
Okay, John, Russ? John, do you want those handouts?
Say again?
The handouts.
Yep.
Yeah.
I have this thing, I'll put it on the screen.
It's up here. Did I just get a copy of this, John, anyway?
Yep. Yeah, it's here somewhere, John, hang on.
Just us.
It's up there too. Can I have a copy?
Jeremy, take it off, please.
What?
That's it, keep it. That's it. That's it.
I got you.
All right, so good evening, everybody. The board is well aware of the history. My name is John Brust, and I'm with Delaware Engineering. The board is very aware of the history of the effort to construct a new highway garage, but very briefly for the public, we, Delaware Engineering, were hired about 1.5 years ago to advance that project. Over the past 1.5 years, we've done complied with the State Environmental Quality Review Act, the SEQR process. We've done that successfully. That's been completed. And then, because the new highway garage is going to be located on a portion of the town park, on Dug Hill Road, we had to go through an alienation process. We had to remove 8 acres from the town park. And then fortunately, the town owned adjacent land, and we took 8 acres of that adjacent land and brought that into the town park. So the town park has stayed with the same acreage. The town board approved that alienation some time ago, and then we took that process to the New York State Assembly and the New York State Senate, and then both houses, they approved it as well. And it's now sitting on the governor's desk along with a lot of other.
It's signed.
It's signed.
It's done, so that completed the alienation process. It took a while to make that happen. I should say that our assembly woman,
Sarah
Just say Sarah Hunter.
yeah, Sarah Hanna, and Senator Hinchy's staff are great. They really shepherded the paperwork through the system, and it was great to work with both the Senate and the Assembly to make it happen. So, the town board now has the opportunity to do 2 things. One, to amend our contract to start the design for the new highway facility. That design would include the building itself, the parking area, the entrance road. We'll also need a well, we'll need a septic system, and we'll need to do a full stormwater pollution prevention plan. And we've given the town board a proposal to do that. So the board has an opportunity to amend our contract to start that work. And also the board has an opportunity to advance the process of selecting bond counsel. And then we would work with bond counsel to arrange for the financing for this project. Our work on the design side will occur over the next 9 or 10 months. And then the construction effort is about a year's time. These facilities are unfortunately expensive. They're needed, but it is an expensive process. And in working with the town board and with Mike Schultes, we've conceptualized a highway facility. In this case, I believe the concept plans were 14,600 square feet based on the equipment that the town of Hurley has and the needs that the town of Hurley has. When you assign $550 a square foot to 14,600 feet, you're right about $8 million. Then you throw some other soft cap costs at it, maybe some legal costs and so on and so forth, and we're envisioning a $9 million project. So the first thing everybody asks is, what does $9 million mean to me? So we've been working with the town board and the town assessor to figure out what that would mean to the average valued home, average valued property in the town of Hurley. The assessor's office says that the average valued property in the town of Hurley is $350,000. The supervisors was talking about that having gone up in the past 8 months, and that's unfortunate for all of the Hudson Valley in terms of new home ownership, but that's a reality that we're dealing with these days. The town has approximately $1.28 million that the town has escrowed that can go to this project. And it's not uncommon for projects like this to be able to secure a grant working with your senator and your assembly person. And it's not uncommon to be able to get $500,000 to go towards the project going that route. They used to call it the SAM program, State and Municipal Facilities. That name has been changed to the Local Community Assistance Program. So that would be part of our job, is to work with both the Assembly and the Senate, your senator, your assembly person, and try to advance a grant, because any grants we get reduce the amount that the town, that we have to pay back, the amount that we have to amortize. The probable period of usefulness for a building of this sort is about 25 years. So when we look at financing, right now we look at 4%, although we had one come in from another municipality the other day at 3.8. And you would, from the national side of things, our impression is that rates are going to come down a little bit. But right now we're looking at 25%, 25 years, amortization schedule, and about 4% interest. So these, let me step back 1 second. We've done a conceptual plan for this highway garage. We've not finalized the design aspects. So if the board chooses to extend our contract, the first thing we do is work with the board, work with Mike Schultes, and really get into the weeds about what we are going to build. And then through that process, we'll come back a number of times to the board and say, okay, the building that you want us to design, it's our best bet that the construction bids are going to come in at $8 million or $9 million or $10 million, depending on what the board and your highway department ask us to design. So it's an iterative process. I said before, let's look at $550 a square foot, because we've seen that on other projects we've done lately. 14,600 square feet. Again, 8 million, other costs, you're at 9. So assuming a $9 million project with escrow money that you've already saved, and with a high likelihood of some grant money, plus some cost that you currently incur for renting space that you won't have to in the future, we look at that last column, the yearly cost based on an average assessment of $350,000. So by taking those other deductions off of 9 million, we're hoping that we come in around $7.3 million long-term bond. That relates to about $65 a year for the average valued property. When we do these kind of projects in other municipalities, as long as that number is under 100, and as long as there's a compelling need for the highway garage, and we're not building a Cadillac, right? Those three things, usually the public is supportive. And that's where you are today, based on the number of properties you have, based on this total taxable assessed value of $1.5 billion. You can spread this bond across that, and we're hoping to come in at 65. It could be 70, it could be 75, something like that per year for the average value home. So that's where we are. I leave it to the board. Those are the two next steps to advance the project. Yes?
Yeah, I just have a question. So is there any point that the public gets involved to see what the design is and have input in that? Does that come from you, or does that come from us to get the public involved?
Well, so yes, good question. So when the board decides to get bond counsel involved, bond counsel will come up with a resolution for the board to approve at a board meeting coming up next month, 2 months from now, whenever it is. That resolution is subject to permissive referendum, meaning that residents in the town, if they feel that's not the best policy for the town, residents of the town could object. And depending on, there's rules for when is the permissive referendum, then require a referendum. In our experience, if there's significant pushback from residents, projects don't go forward. You're supposed to use projects like this to build community, to bring people together. If you propose this project or any other project that tears your community apart with 51-49, then my suggestion is don't do it. You either don't have a compelling project, you don't have a need. There's some reason why 50% of your residents would object to it. So the board's in the best position to judge how the public feels. And so far, we've not had any negative comment from the public in our past year and a half of these board meetings. So my sense is that the permissive referendum period will come and go. And then there's what's called a 20-day estoppel period. That's just to make sure everybody realizes, okay, now we're about to go. And then we do that 20 days. If there's no objection, then away you go, secure a bond, and you're ready to finance the project. Now, in this case, you've got $1.28 or whatever in escrow. You actually don't need the bond to hire us to start designing, because you can use the money you have. And of course, getting permission to borrow money through a bond, you don't actually incur an expense until you use that money. So the public, though, is giving you as the government entity, the public is saying, we give you permission to spend up to this amount. One thing with that, one comment about that. Let's say we come back to the board and we recommend a bond resolution of $9 million. You only have authority for $9 million, not 9,001,000. So we try to be conservative, and if we were not sure about 9, we would say, get a bond for 10, because something could happen during construction, either good or bad. You could say, you know what, we want to have another bay on this garage because we're going to rent space to an adjoining municipality. I mean, that's a good thing to do, but you need to have a little bit of extra funds there so that you don't have to go back through this entire process. That's never good. So when the time comes, we'll come to you with that recommendation, but we'll be conservative about it. You only spend what you need to spend. As far as the town residents having an opinion about the design, they would make those concerns known to you board members, and you would make it known to us, and that's how the process works.
And also, if you look at like 7.3 million, you look at it, it's like the bond payment is 373,000 a year. If we take the entire 7.3 million, we're only paying interest on what we spend.
That's right.
Right, so in other words, so that annual payment is going to be decreased according to how much we spend.
That's right. And from my perspective, we never come to a municipality with one row because we're so early in the process. We have a conceptual idea of what we're going to design, but we haven't gone through the details with the board and with Mike yet. So that number, that 9 million could be 8.5 or it could be 9.5. And we'll get that. We'll go down the road and get that number together.
So this is a 25-year bond for a garage that has a lifespan of 25 years.
The lifespan of the garage will be much more than 25. But the way financing works is the bond is based on the probable period of usefulness. That garage will be there a lot longer than 25 years.
Oh, so.
That's good.
And I may be here.
We'll be
You're
here.
gonna add that up real quick. But yeah, these garages, they're steel construction. They're gonna be around for a long time.
Does anybody have a question to ask John? I assume you all approve that?
Yeah.
Yes, sir.
Would that include lifts and whatnot, that's
Um,
necessary for a garage?
It'll include a high enough eave height to be able to lift the body of the truck up. I don't know that Mike wanted to be able to lift the truck up, but so I don't know. Some communities, if it comes to lifting up the truck, they'd rather send it out to get fixed than put their personnel underneath it and so on. So some communities, on the other hand, absolutely do. We'll see where we go with that.
We also have for $100,000 right now in the capital H fund for solar panels for the garage.
One of the things we talked about is making the building as energy efficient. So we've got some space which would be for offices that would be heated to, a certain temperature. We've got other space that might be at 65. We might have 1/3 of the building where we only heat it to 50 degrees. Along with that, we talked about having some solar capability up there. I have not ground truthed that with the utility company to see if we can sell it to the utility company yet. We need to do that as part of the design process. Typically, if we can go to ground mounted as opposed to roof mounted, we'd rather do that. But the roof mounted panels are much different now than they were 10 years ago, where we were having to penetrate roofs. Nobody likes to penetrate. You got a brand new roof up there. Why are we drilling holes all over it? Now it's different. Now they're set up in a different way. So as we go through the process, we'll work with the board to figure out whether we're better off with a roof mounted panel system or a ground system. And then we'll work with the utility company to see if we can do it or not.
Another potential for that, other potential for. So if we have 120, maybe we can find a grant that'll match.
Yep, gotcha.
So we're gonna be talking soon. You can come back and we'll work on the plans, get going.
Yeah, you have to hire us to do that at some point. So one of the things for you to do is to extend our contract to start design work. We haven't done that yet. You have a proposal, and then we need to work with bond counsel. So you need to decide to advance the project, to have conversations with bond counsel.
Okay. Okay. Any other questions?
Matt, did I leave anything out? We're good? Okay.
Thank you.
All right, you're all. Thanks, everybody.
just want to say something about the garage and so forth. This is needed. All right, I mean, this garage is definitely needed. The one we have right now on Basin Road is out of town, first of all. It's not adequate enough. And the garage that we replaced it with, the old Duggan garage, is condemned. It's a condemned building all the way through. I mean, it's gotta be done. We are not a third-rate community. We're a top-notch community, and we deserve things like that.
Anybody, and if anybody wants to go see the current garage we're using, you would understand, like, literally the walls move with the wind.
We've had in other communities where people have just questioned, do we have a need? We've had open houses, and the residents walk in, they look around, and they go, we need one.
We need one.
Many times they're not safe for your workers. Many times they are not exactly OSHA compliant, things of that sort.
We went down to the Warsing one.
Yeah.
That was just recently built about a year and a half ago.
Yeah.
Nice garage.
For Cadillac.
Mike, I just wanted to point out too, for your benefit or whatever, that as someone that's worked on this committee, that the commute time, so there's a compounded payroll cost that goes on every single day, because the old facility on Dughill Road and the Basin Road facility, are both being used. So the staff is having to go over and enter that, theoretically condemned facility to retrieve equipment on a daily basis. So that's, the logistical concerns of that are definitely, and there's a daily cost for each staff member to commute back and forth to and from the main garage. So that there's an additional soft cost payroll savings that's gonna take place in addition to your $84,000 rental savings over at that building. Yeah, set the community up for 75 years.
Just a quick question about.
What's your name, first one?
I'm sorry, my name is Michelle. My question is the utilities to the garage. Has anybody looked into the cost of geothermal versus solar panels?
So,
Ultimately, maybe it's not set up, but
a few weeks ago, we looked at the geothermal system that the town of Woodstock has. And then I'm familiar with a couple of others. Given where this is going to be situated, it is on a rock. It is on a rock. And I don't think, our sense is that the return on investment just is not there. One of the issues with geothermal is that the control systems have a life expectancy, and that life expectancy these days is rather short, unless the capital cost is very expensive. So,
is it shorter than a solar panel life expectancy though?
yeah, good point, except it's much more expensive. And our solar system these days, at least up to now, have had some subsidies. So a geothermal system up there is probably a $500,000 expenditure. And the control systems for that are probably good for 10 years. So our suggestion to the board is that that's probably not a good place for a geothermal. And that at a certain point, while we all want to, if there's less expensive energy, we want to capitalize on that. But you do need to look at a return on investment and the location of this. On the one hand, the land is free. You didn't have to buy land. On the other hand, you are on rock.
Well, I know Mohawk is on rock as well, and they use it, and it's been pretty efficient since.
I'll be glad to go look at any one you recommend.
Yeah.
And we have no dog in the race. If it's efficient and the return on investment is there, we recommend it.
Yeah, just curious about numbers.
Yep.
You have that information.
So has anyone asked whether or not the old garage septic system and the old garage water system and the old garage land itself, without having to put all new, access roads, new septic, new water supply, new electric lines, all of that, take the building down and build a building there.
Question was asked before we got here, and the town formed a committee to go over that, and that committee's recommendation of the board, as I understand it, was that the environmental situation at that location is risky. And taking that building down and putting a new one up versus go a mile away for land that's also free, there's no cost savings, but going down the street to a new location, it's not a risky situation from an environmental perspective. Now, there is a cost, excuse me, there is a cost for the well, and there is a cost for a septic system. They won't use that much water there, you know? I mean, so it's our hope that essentially a residential well is what we'll be putting in. And the same thing for the septic system, it'll be very much similar to a residential. So that incremental cost,
You just said it was on rock.
yeah, but we can put a septic system there. We can't, I mean, remember, you can have 5 feet
You can have
to rock,
built those
but
systems.
your geothermal's gotta go down, you know, whatever, 150 or 200 feet, or in that case, 300 feet to get a good water supply. So my sense is that we're not gonna get a great water supply there, but my sense is we're gonna get enough for this place.
The other thing is also,
Okay.
the old garage is on condemned land, Superfund site that is not controlled by the DEC, and so we can't even touch it.
Oh, really? Oh, yeah, see, that's stuff I don't know.
It's
also
also
the fact-
landfill, the former landfill site.
I know, I was thinking about that land, you know, that whole thing being right there.
Yeah.
You know.
That's part of it too.
Yeah.
Plus the fact also the old garage is actually built on top of the dump. So we actually, when we drilled down below to see exactly what we do, we pulled up garbage.
And I believe part of the conversation has been, to the extent that there's any storage, any portion of that building that's viable, we can still use that to store some things that don't need to be inside and, you know, we still get some protection without the environmental risk. So Mike Schultes has, and the board has said, to the extent that we can still use anything there, we're gonna use it. If we can't, we can't.
Thank you.
All right. All right, the next one is Peter Stott, request for a public hearing. He's not here, no, we sent in his, form in it. We'd like to have a public hearing. But there's an escrow account that has been sitting at the planning board, so I guess we have to make a motion
I'll make
to what?
Do have the public hearing.
Scheduling it.
The resolution, yeah.
So why don't you review it with the board and at the next meeting, have a resolution scheduling the public hearing.
There is a,
Because we didn't have any information. I didn't see the,
it's basically,
the escrow or anything, like when we got filled out of that information.
I'm gonna get that, if we get a resolution next time.
Okay.
All right, so that's gonna be, tabled. The next one is the, lithium ion storage facility letter.
It's on your screen.
That's starting to go out?
That's ready to go out, yes.
It's ready or it's starting?
It's going out tomorrow. It's being posted on, the website today,
Tomorrow, first thing in the morning.
and then it's gonna be sent out to,
Media will get a copy also.
what we're doing basically is we are CCing everybody from the president down. Literally, in a sense. You know, get this, being done here. So, I'm being serious.
Yeah.
I'm being very serious. We're going as far as up to, the EPA Commissioner Lee Zeldin. You know, and, we know that right now, after some discussion with Lee Zeldin, he is totally against any battery storage plants.
Look at this, they're showing this.
Oh, my
These are all the CCs.
This is the CC list here. Goes on for like a page and a half.
Couple lots of time back.
But the first two CCs is the Town of Ulster, Town Board, and Town of Ulster Planning Board.
Okay, good.
Who's the letter being written to?
The letter is being written to all these people there. They're specifically writing a letter to the town of Ulster, town plant, and we are gonna actually put it on the early letterhead to town of Ulster, right? And then the rest of those.
The rest of
everybody
it
else.
else.
I just became aware of all of this going on recently, and I'm wondering, is the town of Berlin for or against this?
Oh, that's why we have a letter. We're-
No, yeah,
This is not support.
that's what I was,
This is opposition.
I spoke
Put 'em
to,
in there.
I spoke to the water company, Josh, and he gave me a pretty good in-depth background of what's going on there, so I was glad to hear that.
There's one thing also, the letter, now, Debbie at the last meeting read the letter itself. We amended the letter to put in also noise pollution going through there, because further research, we found out that, for example, like New York City has a 42 decibel level, maximum noise. They will allow up to 45, 46, 47, but beyond that, they can't do it. This is gonna be in the same vicinity, about 45 decibels, this whole project. Town of Berlin does not have a decibel level yet. We have a noise control, but not a decibel level that coming through there yet. But this is,
And regulate the properties,
Can't do
located in town of
right. I know. I'm just saying, this is something that's going on.
Noise ordinance, we don't have capabilities of.
I'm not aware of what
They
they're.
don't have one either. Also doesn't have one either.
Yes, they do. In the mid-60s is the max, that's the under. Yes,
And where?
it's
Town
on
of
both.
Ulster.
It's on there, it's on there.
It's just amazing because New York City, anything under 47, anything above 47 stops the project.
It will be right under that threshold too.
It'll be a big hump.
Well, you know, and the thing is, though, the hum is caused by the fans pull down the plant. That's what and this is 24 hour, this is 24/7. It's,
Hundreds of little electric motors running on.
wait, we're gonna do this at the end. We'll have a comment with that. Just want to through all of these first, all right? So please hold your comments to the end. Got that, Ben? All right. Next thing is, the town board meeting for September 23rd. As we push back to September 30th for the Jewish holiday, Rosh Hashanah. So we're gonna meet on the September 30th. We approved it last meeting. Come through, which is not a bad thing because then it still gives us 2 weeks for the agenda meeting in October.
Yes.
October.
Don't say that out loud.
Okay, approved request for proposals for the 329 Old Route 209, RFPs attached. This is the Stangler property. We have contacted the owners and so forth, and nothing's been done about it. We are now sending an RFP to demolish the building. And what we do is, whatever the price tag is, it's gonna go on the tax rolls of that building. We have tried contacting, we've bent over backwards. We have given enough time and then more time, and meanwhile, there's no response. So our thing is, once we get this RFP, that building comes down.
Thank you.
All right?
Okay. Are you motioning that?
Yes. All right. This is on, hang on. Okay, resolution to authorize the issuance of an RFP for cleanup and demolition of 329 Old Route 209.
I'll second.
Any questions?
Diana wants to get out of here.
Diane is right there, you know? All right, seconded by Diane, all in favor?
Aye.
All right, now we're gonna skip.
Skip there.
Okay, all right, resolution to authorize supervisor to execute the updated contract with the SPCA. What it was, some strange reason, the SPCA was releasing the animal that they caught with the owner, and we're asking us to collect the money. We said that doesn't fly. And we've asked them that do not release the animal until you get paid, because we're not collecting it afterwards. The only thing that we have to do is pay for it if it's a stray. Then we have to be responsible for that. But if this is an owner's dog, more or less, they pay for it. And they would actually give the dog out with a pet out, and then we then have to find the owner and then get them from them. We're not doing that. This this is the updated version that has that in there. And there's a few other things here that, took into consideration. Say again?
Did you find the owner then?
Nope. We had 3 bills for $400 for 3 stray dogs. Actually, 2 stray dogs that they picked up, they housed and everything, no one came forward. And then the other one was, a call on Morgan Hill Road for a stray dog, and when the warden went there, they couldn't find the dog, they still charged us for the call.
They definitely will charge it, so it's whether or not they get the dog, it's $100 per month.
Yes.
So that went up.
That's what it is under that contract.
Under that contract.
But that's still cheaper than having somebody on the books all the time being the dog warden. This way we're only paying when we actually need it, so. If you're, you know.
Yeah, previously, I believe it was like 35,000-40,000 a year we were paying.
Because she was getting a salary.
Yeah, exactly.
Plus
Plus we had.
Plus whatever expenses she
that,
had.
plus, you know.
So, there's no cheaper.
Okay,
And I do have one question in reference to 6A, the billing medical expenses incurred in selected veterinary practice shall be billed directly to the municipality. Now, in this reference, they can pick the dog up after the dog is been medically cleared, and then the town can pay. So I don't know if I'm understanding this correctly. So they should still have to pay, doesn't say the owner, it's directly to the municipality. Those incurred in emergency clinics may include in the monthly SPCA invoice, the municipality shall be billed monthly by.
So that's like the whole veterinary.
Correct. So if the dog has medical attention or cat has medical attention and they're gonna bill the municipality, why,
I believe that's, so we can't find the owner.
Yeah, that's,
doesn't
Well, I
state
have to say
that.
that
It
though.
doesn't state that.
Better clarify, otherwise we'll get stuck.
so the change that was made from the previous one is section 4, where
I
it's.
saw that, it's perfect.
Um,
This then rebuts back to,
There's also a sentence under 6 that refers to medical.
Yeah, that's
That's what we're
he's
talking about.
referring to.
No, not A. For that, right,
all
so
rules,
the
it all
village
rules.
non-director.
I'm more worried about the veterinary costs coming back to the town. So I'm asking $1,000. And if an owner picks the dog up and walks away, they don't, well, thanks for paying for my dog's brand new leg or whatever, the cast or whatever.
Yeah, if the dog is at the veterinary clinic and isn't brought back to the,
Table this till we can.
Yes.
I would recommend that.
I motion to table it.
Second.
Oh, sorry, we're tabling this?
This is for, that
Mike,
might
we're tabling this?
Yes.
Okay.
This is a new contract with the SPCA. So I'm just trying
Thank you, John.
trying to cover up a little bit.
Okay, next one is, deputy clerk. I guess our last meeting, we reported the resignation of Kathy Helbig as a deputy clerk. And we have now, it was recommended to the board to hire Jeffrey Mann as the deputy clerk. All right, so resident to appoint Jeffrey Mann as deputy clerk. All right, make a motion.
Oh, okay. Can I ask a question?
Go ahead.
Yeah, this hourly wage, is that what it was before?
It's 2040 is what it is.
If what it currently is for any deputy.
But, because it's by waiver, you don't, it's not by example, you did it.
There's no two yet.
Start.
Okay,
Not yet. It's gonna be while we're working.
yeah.
Shouldn't, excuse me, should this read first deputy?
That's something we decide.
Like we already have. You don't. Stephanie's the second deputy. Kathy was the first.
Yeah, but you decided,
There's
One
no
is exempt,
difference
one is
in
not.
the actual definition of paying.
Not on the CPA.
Yeah, so for the purposes of what they're doing, it doesn't matter. You're the person who says you're first deputy, you're second.
When I get my hat that says your number
But for the purposes of what they're doing,
One
I'm
position is
saying,
deputy.
yeah.
But, with the longer we get the,
it's up to the clerk.
It's up to her. She can do.
And also, one position is an exempt position, and one position is not an exempt position, unless it's made so by the authority has to be in that person. So it would,
Okay, but so we can approve this as.
Yes.
You can approve it as it is.
Whatever she wants.
To do.
I make a motion to
Well,
accept.
you made it, and I seconded it, we discussed it.
We discussed it.
We interviewed him yesterday, and he was right on. He's really good.
Okay, we're ready.
Okay. All in favor?
Aye.
Aye.
Two apps.
We need it.
Two abstentions.
Yeah, two ayes.
Okay, set a public hearing, for proposed local law on false alarms. I guess, should we maybe do it, wasn't here?
No, I thought he was coming.
Mike, may I comment on that?
Yeah, yes.
I read the proposed local law, and I'm gonna respectfully request that you table that. I don't think the law is well-written. It starts out with the town board is concerned that a large number of portable fire and carbon monoxide alarm signals are there. I don't know what that number is. I don't know that it's large. Also, there are aspects of the law which ultimately come back to the code enforcement officer, and we are mandated to do multiple contacts, collect bills, take people to court, which involves the accusatory instrument, pretrial conferences with the attorney, collect the money, only to give it over to the fire department, which I don't feel is appropriate. And other than that, there is a bill that's passed the Assembly, I believe it's passed the Senate also. It is Bill 83343. That deals with false alarms, and it does incorporate errors by the monitoring company, the Central Station Alarm Company, which this law neglects. Now, obviously, anything from the state doesn't preclude local laws being adopted, but I feel this is inadequate, and it puts the bulk of the work on my department, and, to no avail. We don't generate revenue from it if we're giving it back to the fire department.
Let me ask you something, isn't there a fire police in town early at all?
Isn't there what?
A fire police? I always see them as the fire coming around. I always see these guys wearing fire police, shirts.
Not in town of Hurley, it might be something with the county agency.
State fire.
Volunteers. Or volunteers, right, they have vehicles. But I just, like I said, if there've been 3 alarms in 2 years, I don't know that, public education might be better than passing another local law.
It's not 3 alarms, it's multiple alarms on a regular basis.
Okay, and these alarms are is it an error from the central station?
It's a condition that should be fixed by the owner
100% of the
and
time?
not getting fixed.
Okay, and that number
That in
is,
one specific instance.
Okay, and that
There are
number
other
is-
instances where there's false alarms, couple come in, the owner realizes they correct the situation, there's no fines issued. These are only for chronic calls. Because what's happening is, these are volunteers that are getting up, leaving work, getting up in the middle of the night, going to these calls. It's the same situation over and over again. They're not getting up and going to the calls like they used to,
Okay.
which you can totally
but then
respect.
the law defines chronic as 2 times issuing appearance tickets and collecting fines.
Well, no, it's 2 times to issue a warning letter. So basically, once you're notified by the fire department that there have been 2 of those, you issue the warning letter, and then on the 3rd, that's when.
And if they don't comply, it's mandated that
Well,
they
if
issue
it's
appearance.
basically, if there's a 3rd, you send, okay, you're fined $250, and if they don't pay that within a certain period of time, then the appearance tickets.
Yeah. And then ultimately, if it goes to that, I've expended all my resources, and the revenues go to the fire department.
That's the way it's written.
Not the branch of the town that's doing local work. So I just, personally have an issue with that. I don't know if there's a better way of doing it. But, if the town board adopts it, so
This
they.
law-
This is
This is
just
modeled on Olives, and there are other towns that have other
And we can look at
regulations similar.
Yeah, I'm just looking
But
at
the
whether
other
we're-
thing is, you can take into consideration what, Paul has to say. There may be, this can also.
I understand his concern.
Something where whatever funds are taken in are distributed as, resources, so not only to the fire department, but also the town keeps on and something.
That's fine.
Yeah, I
All
think-
right, so we'll table this, I'll make a motion to table it.
I'll second.
Thank
All
you.
in favor?
And Paul,
Aye.
I'd recommend that, before it's back before the board, if you have, just send the, board members, an email with any other recommendations.
What I'd like to do is consult with Fire Inspector Clark Campbell, who's out of the office for 3 weeks. He's dealt with this expansively in the town of Ulster. He has 42 years in the fire service industry. He's basically Hurley's resident expert on it. The man's extremely knowledgeable, and he has some insight into this.
Thank you, Paul.
You're welcome.
Okay, next thing, that's table. Authorize the town to budget for rail trail service upgrade grant. There is a, yes, this is the last one, there's a, we have put in for a $69,000 upgrade on 3,000 feet of rail trail that starts on the Marltown side, which is paved, then it goes 3,000 feet up to over here, like that's the water, we was unpaved. And what happened basically is, the Community Foundation of Greenway, they have money for rail trails. It's a 50-50 match. All right, so we priced everything out at $69,000 to have it paid, not necessarily paid, but have a trail mix. The trail mix being put in place there, and it came out to be like, we asked Mike Schultz, we then budgeted $69,000. So our share would be something like $34,500 on this thing. Yeah, however, Mike Schultz has said he would do the work. So the $34,500 will be in-kind service, and the materials that will come from Community Foundation of Greenway. Or do that. Now, this is the same grant that gave us the
Yes.
kiosks. All right, so basically, like with this whole thing with Greenway, they are upgrading all the trails. So this is the trail we have here. We would like to also think about doing the trail on 28, except they call it the Woodstock Trail. You know, it starts in West Hurley. Woodstock Dyke, yes, it's a West Hurley Dyke. So until they change their name to West Hurley, then Woodstock take care of it.
Yeah.
It's part of your thing also, isn't it?
Do we get a first
So where's the in-kind money coming from?
To me, Mike Schultz is doing the work.
Still got your pay.
Well, the thing is, it's gonna be paid in the sense it's cheaper than,
I understand, so where's the in-kind money coming from?
we have a capital fund for rail trail.
Yep.
And we're sitting here with,
That's 38,000.
rail trail has $38,000 right now.
So that means you're gonna expend everything for that. Then we still have paving that needs to be done. Potential, and you know how the trail looks from all the way to the bridge. That's gonna need probably blacktop in the next 5 years.
Good, yeah. But I think this is something that we've had complaints already from a lot of people, where they actually would go from like, the rail trail right over here down towards Vessel Road, which is fine, then if that's all dirt, and then rain gets real much.
I'm just making you aware.
I know.
You're down to 4,000 and you completed that count. Future issues.
Well, I think Michael just put it under his budget. He's done it before with other things. He will. Okay, make a motion to, apply for this grant.
I'll second.
Okay, second. Any further discussion? All in favor?
Mike,
You want to say something?
you mentioned something when you started the conversation about the fact that it's the Marltown paved.
No, Marltown,
There's no pay, I mean, there's
it's
a.
not paved, it's a rail trail, it's a trail mix.
Completely, it's multi-surface trail that goes all the way to, the next. Yes.
All I'm saying is basically that I was there with Tony one day when it rained, and you really can't walk in that.
It's gotta be, it needs a fix.
Yeah, it's very good, so.
I mean, the thing is, it's grant is there.
Yeah.
So why not utilize it?
Right.
It's not nice. Okay, all right, I make a motion to open up public comment number 2. The line starts over there. Second, all in favor?
Aye.
Oh, by the way, I just got one thing. Thank you, Ralph.
Thank you.
Thank you, Ralph.
Thank you very much.
Thank you, Ralph.
Take care, Ralph, citizen.
All right, if you wish to speak,
Go to the mic.
Steve Ballard, did you want to talk?
Sure.
Any other question? Okay.
Thank you, sir. I submitted this letter to Ulster at their board meeting. I wasn't able to attend, but I had somebody read it to them and submitted it to them. My name's Steve Bauer. I'm a 20-year resident of Hurley. I'm writing this to voice my opposition to the proposed BESS facility on the grounds of Coleman campus on Hurley Avenue. I have 37 years of fire service, 25 of those as a paid professional firefighter. I have many concerns regarding the proposed facility, but my main concern is fire. In recent years, lithium-ion battery fires have increased at an alarming rate. I've been involved with a few in my career. They burn hot, fast, and are extremely toxic. They're difficult to extinguish due to the self-igniting properties of these batteries. It takes very little time for a battery failure from a small electric scooter to become a large-scale fire, causing catastrophic damage. Electric car fires are another type of lithium-ion fire. These fires are extremely hard to extinguish, needing 25,000 to 50,000 gallons of water to put them out. Is it advised that after a car fire is out, that the car be submerged for a week to prevent reignition? What is being proposed is thousands of times larger than any car fire. It will not be able to be put out. It will have to burn out. Since 2022, this company has had 3 fires. My understanding that each trailer will have a fire suppression system, but systems fail and fail often. As a matter of fact, one of the suppression systems failed and damaged the batteries at one of TerraGen's facilities. This is not a question of if there will be a fire, the question is when, and what is left will be a hazardous material site. When one of these lithium-ion trailers catch fire, the neurotoxins and carcinogens released will be a health hazard to all the community. Hydrogen fluoride, hydrogen cyanide, carbon monoxide, and heavy metals are just a few of the toxins in the smoke from these fires. Hydrogen fluoride, which can attack the calcium in bones, turns to hydrofluoric acid when mixed with the water used to fight the fire. This has the potential to get in our drinking water. Some of these poisonous byproducts are heavier than air and will not just dissipate. This is the reason for the quarter-mile evacuation. Some have stated that smoke from residential structure fire to be more hazard than a lithium-ion fire, yet we don't evacuate a quarter mile during structure fires. Evacuating hundreds, if not thousands of people from the surrounding area will be another task. With many apartments, some with elderly, within a few yards, and 2 schools within a half a mile, this will be a chaotic scene and expose those trying to escape. TerraGen's own spokesman, Mark Turner, stated that the BESS in Valley Center, California, which has had a fire, was chosen because it is remote. Hurley Avenue is not remote. Higher energy bills, possible water, ground and air poisoning, and lower property values for nothing. The electricity is useless if transmission lines are down. I know TerraGen is making high dollar promises to the surrounding communities, but tell me how much is a life worth? Look around and decide which of your friends and neighbors you want to expose these deadly chemicals. If it goes through, that's what you're going to do. In the fire service, we have a saying, risk a lot to save a lot, risk a little to save little. It seems to me to be risk a lot for nothing. As a shift commander, I would not put one of my guys within a mile of here if there's nothing they can do.
Thank you.
Thank you.
Sure. Yeah, I want to add something also. I went to a conference with my servant, who has approved this plan saying it's safe there. One of the questions I was asked, why don't you have someone on site to monitor everything? And the answer was, well, you can't, because if the fire starts, he will be immediately incinerated. So I said, okay, that's a good reason to have it. And the thing is, and I read in the paper also, if Kim will look in the paper, that even Jen Mesker is against the project. I'm just saying in the paper, she said she's against the project because it's located in a residential area. Yeah, I don't know if she changed her mind. This is what I was reading came in the paper and all that. The thing is, though, whether you're against this plan for safety reasons or not, putting it in the middle of a residential area is just insane. It's just insane, especially since there are sites along the way. You have I Park, which is an industrial area. You have a huge industrial area down in Island, New York, that we accept this thing, and there's very few houses around it coming through here. You know, so, this is a disaster that's waiting to happen. And we will feel the brunt of it while, you know, while also we'll get the rewards, monetary rewards. You have to understand something also. I kind of figured out how much they're gonna make, Terrigen, on this thing. They are gonna make somewhere around $30 million annually on buying cheap, selling hot.
Yep.
Now, they're gonna make $5,000 an hour during this thing. $5,000 an hour for 5 hours of peak times, $25,000 a day. Multiply that by whatever, you get $30 million. They're gonna make. How much of that money is going to Ulster? How much?
Well, they have a
Try nothing.
pilot. They have a pilot, right?
They're gonna go for a pilot, though, but I'm talking about doesn't reduce the,
Oh, you mean the electricity, where would that
doesn't
go?
reduce the rates in Ulster.
No.
The consumers there get benefits, the answer is no.
That's absolutely unacceptable. I mean, really, absolutely unacceptable. Because, you know, I mean, just common sense to me is they say we need a place to store this extra electricity. But that means when are they gonna use that stored electricity? That's my question. And if they say, well, we'll use it when there's an overload demand, so and so. Or we'll just, if we're stocked up and we can just cut down on our fuel consumption that's making electricity maybe.
Are they gonna buy
And
it?
so that all those savings should be passed right along to us.
But it's not.
And it's not gonna be.
You're gonna buy it at night and then sell it back during the day?
This is my market, well, this is capitalism, this arbitrage.
This property is only gonna be doing this for 15 years, so 20 times.
Then what happens?
And that's average, right?
Battery's gonna have to be replaced in about 10 to 13
I
years.
invite people to come in.
Okay, anybody else wish to, make a comment? Come on, Julian.
Sandra Lumber, great.
Yeah, it is.
Yes.
Good job, everyone, housing the signs and, the bright yellow, so thanks for putting those on your lawn. Billion Freed, 128 Raina Street. So first, I'll just start with this, just to see where you guys are at. So at the town board meeting on Tuesday of July 22nd,
Talking about the Ulsters or ours?
ours, Town Hurley, under the resolution, you had talked about establishing a new capital fund. I just kind of wanted to see where you were at with that. I believe you were gonna title it something along the lines of professional consultant services. I just wanted to see, is it,
Stop.
it's done, you voted on that, it's all done?
We have a capital fund for that.
Awesome, thank you. Yeah, that deserves a clap. So two, about the Jen Metzger thing. I guess I read that statement a little differently. I guess my interpretation of that statement is that, although she said it shouldn't belong in a residential neighborhood, however, if it goes through the seeker process and they deem it safe, she will be all fine with that. And I just saw recently, her getting very upset with, you know, the EPA committee about how, they're pretty much just not moving towards green initiatives with that. So, this is very much in line with her. I think it was a positive statement, but I think it ends with the secret process. Three, about the pilot. So I actually called the Ulster County, IDA, Industrial Development.
Agency.
Thank you. As of right now, Terrigen has not applied for a pilot. It's actually not the only avenue they could go. There's multiple financing avenues they can go. A pilot is only one of those ways. They can get other government incentives. I don't know which way they're going to go. However, they do have a wind farm up in Plattsburgh, New York, and they did apply for a 30-year pilot agreement. They actually got denied. They didn't apply for that, but when they apply for that, if they do, and they get approved, Kingston City School District actually has an opportunity to be involved in that. So I'm honoring that. And just lastly, at the last Ulster Town Board meeting, I'm really trying to fight the whole classification of the public utility company structure. I am going at that, and I am going at it hard. And although their previous battery storage project, the Glide Path, Ulster categorized that as the same classification. There's several places in New York State right now that are disagreeing with that classification. They are saying that it is not a public utility, it is not managed as a public utility, it's a private for profit by the developers. So I think that if the opportunity ever arises,
Well, Mark Turner finally admitted that this is not a renewable project.
But that's different what she's.
I know.
I'm talking about the zoning.
Right.
So yeah, that's where I'm at. So thank you. And yeah.
Thank you, Jillian.
There.
Good evening, my name is Donita Johnson. I just wanted to say, as a 6-year resident of Burley, I'd like to thank Supervisor Bonds and all of you councilperson for your proactive stance against this lithium-ion battery storage facility. It's not always popular to take a stand against something. I personally know that. But I appreciate your integrity that's been shown by each and every one of you. I don't believe for a second that this stand is due to it being an election year. I do believe that our neighboring town, the town of Ulster, has lacked transparency in this matter, which I have communicated via email, written letters, and by speaking to the town of Ulster, at the town of Ulster board meetings. We as a community, not just in Hurley, owe it to our neighbors to demand transparency, and that Terrigen, as well as the town of Ulster, are held accountable for each step that they are taking. This is not renewable energy. The risks far outweigh the benefits, which would only seem to be corporate profits for Terrigen at this time. Thank you for the opportunity to address you tonight.
Anybody else wish to speak?
I have just a couple things to add on. So I did speak to Sarah Pasty, who's Ward 1 for Kingston, who is representing Stony Run. She wants that conversation with you, Mike. She's looking forward to this letter be hitting her desk, so she can send it to her, so she can chat with her representatives in the city of Kingston. She has submitted a letter, it fell on deaf ears. I think this would assist her, and maybe some collaboration of those folks, the city alderpersons. So, Sarah Pasty. So I know she's been speaking with Jillian, and I know there's a meeting happening in the next couple of days in reference to pulling together some coalitions with Stony Run and Country Village, along with Sarah Pasty and Jillian. So, I mean, this definitely is, everything that they're doing is amazing, and I hands down appreciate everything you all are doing. Before I came in, I did get a little information from a friend in Albany, so this should, I don't want you to take this in a bad way, I want you to take this in a good way. So Terrigen has now hired a lobbyist to try to assist them in this situation. We should look at that as a positive.
That's right, yeah, it's fair, they're feeling the opposition.
Right, so in this case, that just happened today, so this is what I found out. And lastly, one of the things I'd like to present to the board is there's 101 acres off 28 that actually runs along those high power tension lines that literally sits down below, actually right below Jim Quigley's house. I would think that would be a much better situation for this battery storage plant. So I spoke to the broker, the owners, they would definitely entertain this. So with the board's approval, if I can continue working on this, because that potentially present this to the town of Ulster as an alternative.
There you go.
Great.
Beautiful.
Might as well come up with a solution.
Absolutely, offer an alternative.
So I'll continue with that.
Thank you. Because that's what our letter said, is they should be looking for alternatives instead of putting in a.
It's 101 acres, it sits down below, plenty of buffer zones. So, and again, the tension runs right through, so they can't say that they can connect.
We put a substation right there.
Good, great.
You know, I also heard the fact that when the archdiocese sold Coleman High School, the intention was to sell it to a real estate agent or affordable housing.
Right.
And that's one reason why the substation was put there,
With affordable housing.
was affordable housing. And then that real estate person then sold it to somebody else, and now it sits on Perry Jane. The situation going forward. I remember talking to Jim Quigley about one that had it at I Park, which is an industrial area. He said the substation there is way too small. He said to me that it would take 5 years, at least 5 years, before the first shovel goes in the ground. I said, Jim, that's 5 years' time to build up a substation at I Park then.
Still homes there and school there.
Oh,
And Terrigen actually said that that location was too small for their projects. So, yes.
The only thing I find really interesting about Terrigen, they said they put trees all around, actually, hide the hum. To me, it's more like kindling.
Yeah.
Well, also.
Anybody else want to speak publicly?
Why not?
I'm really just kind of parroting what everybody else is saying, so.
What's your name?
I don't have a speech or anything. No, that's
Okay, you don't get
Just pull the mic up a little bit. Do a little taller than the last speaker.
And what's your first name?
Wasn't Steve?
Michelle Renard. Yeah.
What's your last name?
And you know, where feels around. But, Michelle Renard, sorry. I live on Joyce Lane. So Steve is my fiance. He just spoke to the fireman here. I just wanted to say, actually, I'm really happy. Like, I've kind of gotten really discouraged with governmental people because they don't often do what you ask them to do. And you guys are really working for your community. And I want to say, I really appreciate that. A lot of people don't want to stick their necks out because they're afraid of the position that they hold and what that's going to mean when they do something. So anyway,
We're not politicians. We're residents.
elected officials.
Trying to help and take care of our community.
I
We're
think
for you
what-
guys, that's right.
Yeah, but I think what my concern is, even if we put this in the town of Ulster, it still defeats the purpose, right? So like, this is a 250 megawatt facility. That Moss Landing was like 300, I think, megawatts. That thing lit on fire for 10 days, was it, Jillian? 10 or 15 days?
was 5 actually.
Was it 5 days?
Yeah.
Okay, but the smoke went 10 miles at least, so
Yeah, you're right.
all the communities are gonna be affected. I don't think we should have any of these, to be honest. So that's just, the reality of the situation. We all know it's not gonna generate energy on its own. It's just, it's a Ponzi scheme.
Right,
So
so
I just think
it's gonna make money.
anybody who does a quick Google search would see the risks, the benefits, and it's all risk, no benefits.
Right.
Especially if they're not gonna pay it off before it's used up.
Right.
So,
Right.
that's all.
Thank you.
Thank you, Michelle.
Remember that, Chris?
Hello, I'm Jennifer Scott. I live on Orchard Street in Hurley, and I just want to say that I am opposed to the BEST plant also, and I really want to thank the board for sending this letter and for being against this. It's just a terrible idea. I mean, it's too densely populated. It's not the right site. And I have a question as well. Am I right in sensing that there's resistance from the town of Ulster? Or are they for? Is the feeling like they're for this?
They don't appear to be against. They don't.
Okay.
What they're afraid of, their zoning allows this to happen, that if they choose not allow it to happen, they could be sued and possibly lose. Do that, because their zoning permits this plant to be there.
But they're also getting,
Legally
speaking, how much money are they getting for this to come in? $2 million.
$2 million.
$2 million.
Are going in, right? They can't play their cards right now.
They can't what?
They can't play their cards right now. They
No.
can't show
Have
their,
to follow procedure.
I
They have to follow the process. They're saying, right, everything's got to
I
play out.
see.
they have to follow the
There's a
procedure. They have
process.
to go through the seeker. There's a
Yeah.
whole legal thing. And if they weren't to give them a fair try, like every other application that would come through, then they would open themselves up to litigation. And they have gotten sued before a lot by one person in particular.
Well, I find it interesting that they were so against that gas station that they don't seem to be as against this.
So the fire risk, right?
Yeah.
So he will go and sue them again.
And he wasn't giving them $2 million.
Interesting. Okay, thank you for that information, and thanks again for doing the right thing for our community.
We can do a lot of things here. You can do a lot more,
Yeah.
all right? Because, you know, things are, I have a good relationship, well, I had a good relationship with Jim Quigley. But I still consider him my mentor, you know, and so he has helped me a lot at running this town and so forth. But, you know, I disagree with him on this thing overall, and I'm entitled to disagree with it, especially since I kind of know the dangers of this. Come through it. You guys have to be the vanguard. I will be with you, not as town supervisor, but as Mike Baum's Hurley resident. I will be there with you, as we storm the Bastille.
Show up to the meetings. I have to say, the August attendance was abysmal. I know it's summer, but we really need to ramp up those numbers.
Yeah.
Yes, Town of Ulster meeting, yes. I
When's
mean, it's
the,
just
when's the
declining.
September? July was good.
July, the first one was great. The room was packed.
And you had a great presentation, Mike.
Yeah.
During that meeting, all the information that you presented on the facts, the science, I think that was extremely important, very helpful for me to hear that.
You know, there's
When's
also.
the September meeting?
They haven't posted it yet, but I'm sure it's probably in the third week.
I just want to say, I got some comments from the Ulster Town Police. They were out in force at the last town board meeting.
They were.
They were out in force.
There was like 10 of us.
Right, but they didn't know that. They thought there'd be a
Another
lot more.
protest.
They were there. They were full alert and all that, right? Kind of,
Civil disobedience.
Okay, anybody else wish to speak? I make a motion to close public comment number 2.
Second.
All in favor?
Aye.
I make a bigger motion to adjourn this meeting.
Second. Third, second,
Fourth.
very nice to meet you.
All in favor?
Aye.